afternoon, everyone. Welcome to this today's CECAN webinar. I'm Ben Shaw. I'm Deputy Director of the CECAN Research Centre and Principal Consultant at CECAN Limited, which is a consultant set up to deliver or build on the demand for some of the approaches we developed. For those of you not have heard of CECAN before, it's the Centre of Evaluation of Complexity across the Nexus, which was set up to transform the practice of policy evaluation across the areas of food, energy, water, environment to make it fit for a complex world. We've broadened out our remit and now do work in many policy domains. But the way we worked is we've pioneered, tested and promoted innovative policy evaluation approaches within UK government departments, and there's lots of details of our approaches on the CECAN website. Today we're talking about lessons from commissioning, implementing and evaluating a multi-site complex systems change programme using a developmental evaluation approach. And we've got delighted to have Hardeep, Aiden and Joshua Butt presenting the webinar. When he is doing the work, Hardeep was a research manager at the Health Foundation, but has recently moved on to the Lambeth HDRC, which he'll say a bit about in his presentation. And we also got Joshua Butt, who's Principal Consultant at Cordis. There'll be an opportunity for questions at any point during the session, but please put your questions in the question box, which you should be able to see in the Zoom webinar control panel. And you'll also be able to upvote questions. So if you see questions you want to see people Hardeep and Joshua answer, do upvote them. We'll be recording the session, and the recording slides will be made available later on the CECAN website. So with that, I'll now hand over to Hardeep and Joshua for their presentation, and I'll speak up for about 40 minutes before we take some questions. And I'm interested to hear your responses, Hardeep and Joshua, to that Mentimeter, whether it aligned with your thoughts. But handing over to you now, Hardeep and Joshua.
Thank you very much. Very much aligned with our thinking. Thank you everyone for joining us today. We're super excited to be here and talk to you all today about the 3-year systems change programme that Josh and I worked on quite recently, with a particular focus on the approach that we took to evaluating the programme. So I expect we'll cover a lot of the themes you've already jotted down, so thank you for engaging with that. But we'll do so within the context of the work we carried out. We have split this session into 3 parts. So first I'll give you some background as to why we commissioned developmental evaluation and what we actually mean by developmental evaluation within the context of the work that we did. And then in part 1, I'll give you a brief overview of the Shaping Places for Healthier Lives programme, or the SPHL programme, and the programme evaluation. So we'll be talking about the aims of the SPHL programme and how it was delivered. And then Josh will give you a quick summary of the research methods his team employed. And then in part 2, Josh is going to go into a bit more detail about the lessons we learned during the course of the SPHL programme. So in particular, what we learned about taking a complex systems change approach in the 5 SPHL sites, what worked well, where the challenges were, that kind of thing. And then we'll come back together in part 3 to share what we learned in commissioning and evaluating SPHL. So particularly commissioning a developmental evaluation approach and why do it? And then the successes and challenges of taking that kind of approach. And then we'll end with our conclusions before we move on to the Q&A. I imagine we'll have lots of questions, so we'll try to address as many as we can in today's session, but let's see how it goes. Thanks, Josh. Right, so I'll say a little bit more about SPHL in a few minutes. But essentially, it was a grant programme designed to support 5 sites to use systems approaches to tackle a public health challenge in their patches. Easier said than done. And in commissioning and evaluation of SPHL, we really felt a developmental evaluation approach would be a bit more suitable for what we had in mind than a traditional evaluation. So we wanted something that would be rigorous while also able to evolve alongside the projects as the project teams learned and adapted and as the local systems change as well. And we wanted to do this in real time, or as close to real time as we could make it. We also wanted something that would take full account of systems thinking to capture complexity. So the interrelationships underpinning each project intervention, being able to engage with the perspectives of the multiple stakeholders involved in each project, and really to reflect on the choices made about system boundaries and points of intervention within each system. So what's included and what's not included in each intervention. And we wanted an evaluation that would an approach that would engage with and support reflection. That was really key among the multiple stakeholders involved. So supporting reflection around their contributions and their roles in relation to the project-specific context and processes at work. And we also wanted to make sure that we built in regular and timely feedback with the project team. So we expected from the outset that the project teams would encounter a range of challenges in trying to tackle their public health challenges in innovative ways. And we wanted the evaluation team to support the project teams to respond to the evaluation findings by providing ongoing and timely feedback. So I'm just going to, before we discuss the program in more detail, I just want to explain what we mean by developmental evaluation, how we understood it in commissioning this evaluation. So table you can see in front of you draws heavily on Michael Quinn Patton's work, which I'm sure many of you are familiar with. For me, these are ideal types. So according to Patton, in a traditional evaluation, the evaluator tends to support improvement, summative tests, accountability, whereas in a developmental evaluation, the evaluator tends to support innovation and adaptation in dynamic environments. Don't disagree with that. But as far as the other bullet points are concerned, as I said, we understood these as ideal types rather than strict criteria that we had to adhere to. So in a developmental evaluation, the evaluator is often positioned as part of the internal team and involved throughout in terms of gathering and interpreting data and so on. But as I'm sure some of you know, that's very difficult to implement. It has budget implications as well as governance implications. And I don't necessarily think you have to have that in every single type of developmental evaluation. Along the same lines, providing rapid real-time feedback, I think, is a really key feature of a developmental evaluation and one that we wanted. But we also wanted annual reports and regular reports from our evaluator, not only for our own purposes, but also, quite frankly, for the sites. They also wanted to see reports. Similarly, a key strength of developmental evaluations, I think, is being able to learn to respond to lack of control, staying in touch with your unfolding environment, responding accordingly. But I don't think that should be seen as a substitute for upfront planning or an excuse not to do the upfront planning. And we spent a lot of time at the beginning of our evaluation just scoping it out and then re-scoping it once Josh and his team were in place. And I also think you don't want developmental evaluations to be any less rigorous than other approaches. And I think independence is an interesting word that is touched on in the literature. I think often we think about the position of the evaluator vis-a-vis the project team, but I think regardless of which evaluation approach you go with, you absolutely want objectivity, and that's what we were looking for in our approach. Right, so I'm going to talk a little bit more about the program itself now. So I don't know how familiar you are with the public health literature or wider determinants of health, but essentially the strongest determinants of health and health inequalities are known to be the social, economic, commercial, environmental conditions in which people live. And that's what we call the wider determinants of health, or the building blocks of health, as the Health Foundation tends to describe them nowadays. And when I was at the Health Foundation, we partnered with the Local Government Association, or LGA, on the Shaping Places for Healthier Lives program, so the SPHL program. to support local government-led partnerships to tackle the wider determinants of health or building blocks of health in their local areas, and share, more importantly, the learning that they develop through that process about effective ways of shaping their places to make them healthier for their residents. So in that programme, we funded 5 local government-led partnerships, and we had 3 overarching objectives, which you can see on your screen. So one was to mobilise cross-sector action on the wider determinants of health through sustainable change at a local level. And by sustainable, I mean change designed to last beyond the lifetime of the programme. So we knew that in 3 years, it would be very difficult to implement changes and see the fruits of your labours within that period of time. So we were much more interested in the learning that was generated than we were in the outcomes. We were quite clear with the sites that we expected outcomes to be. We wouldn't expect outcomes to appear till 5, 6, 7, maybe 10 years down the line. But our objective was also to support local authorities to develop those local partnerships for system change on the building blocks of health. And those partnerships largely involved VCS partners, but also involved commercial or business partners, and in some cases, academic partners as well. So a real mix of stakeholders in each project. And as I said, we were really keen to share learning about making sustainable changes to local systems, changes that are consistent with improved population health and designed to last beyond the lifetime of the programme. So those were the sort of key elements of the SPHL programme. A brief overview of the timeline. So we actually launched SPHL in 2019 and invited applications from local authorities across England to take a complex systems approach to a public health challenge that they were interested in. I think we had over 100 local authorities in England apply, of which 14 applications were actually taken forward. And each of those were awarded £20,000 as a development grant, and were given expert support to develop their final proposal through system mapping, developing a theory of change, and then also building local partnerships. And then of these, 5 local authority-led partnerships were chosen, and they were each awarded £300,000 to put their complex systems change approach into action. Now, £300,000 is modest in the grand scheme of things, but I think enough to start to build those relationships and start to think about how you tackle public health challenges using complex systems approaches. Obviously, this all happened in 2019, going into 2020, and then COVID-19 arrived, which disrupted and delayed the early delivery phase. So the whole project programme was delayed considerably. But once we got going, we managed to work with 5 incredible sites, which I'll talk about now. So the 5 local authority-led partnerships span the whole of England, covered places both small and large, urban and rural, and each determined their own system of interest. So the place of focus and the challenge that they wanted to tackle through systems thinking and systems approaches. So the 5 local areas in England which participated in SPHL were BNSSG, as we called it. So that's Bristol, North Somerset and South Gloucestershire. So Avon, as some of you might remember it. And that was a partnership of local authorities working together to improve food security. We also had Shaping Stainforth, led by Doncaster Council, and they focused on mental health and the community, and especially for younger people in the town of Stainforth, which has a population of around 6,000 people. And then closer to home, we had London, the London Borough of Newham Council, and they worked with the Association for Young People's Health and also focused on food security for children children and young people aged 11 to 19. And then at the other end of the country, we had the Hearts of Blythe project that was led by Northumberland County Council, and promoted community and tackling, and they wanted to tackle fear of crime as well using asset-based approaches. And then lastly, Shropshire Council, in partnership with Citizens Advice Shropshire, focused on food insecurity too. And that was in a rural context, which was quite a nice complement to the other food security projects that were going on. So we didn't require the local authorities to follow a particular approach to systems change. Each determined their own idea, but they had to have particular features. So a complex systems perspective, a systems approach, i.e. they couldn't fund a new service model or intervention. Partnership working absolutely had to be a key element of the work. And then really importantly for me, and for Josh, as he'll say in a minute, potential for learning. So I'll hand over to Josh now so that he can set the scene for the evaluation.
Absolutely. So I think Hardeep set up really well what that group of local authorities were like and what they were being asked to do and how the programme came together. I think the thing I would just emphasise at this point is there was significant diversity in what then emerged subsequently. You've already heard about the different types of areas, the different systems they're working in. There are obvious differences in the places that they were. But having said that, just to be clear, there were also quite a lot of similarities about what emerged. So when we were looking at these 5 different complex systems and the changing approaches they were making, there were these things that drew them all together. So if you ask them, you know, what are you doing to try and change this system? Well, actually, we're trying to work at lots of different levels of the system at the same time. So that might have been levels conceived as, you know, we're trying to change policy at the same time as relationships, at the same time as attitudes and behaviours. It would also be, we're trying to do something in this part of the town, but also there's another activity going on in that part of the town, and taken as a sum of those parts, that's our approach. So there's working at lots of levels. The idea of emergent properties, so that analogy of greater than the sum of your parts, that was a refrain that we heard again and again. You know, it's lots of little pieces being put together to create something that cumulatively is going to shift the dial in a way that none of those individual pieces might otherwise have done. Relationships and seeking input from diverse stakeholders. So much of the work that we're going to talk about in the rest of this presentation really focused in on relationships in those places, and it's about trying to hear from new people, but also that connecting and convening people, not just hearing from them and being at the focal point and taking in all that intelligence, but getting those people around the table, getting them working together and talking amongst themselves as a means of change. And I suppose the last part of it was being dynamic and adaptive. The world kept changing throughout this programme, throughout this evaluation, and our sites changed with them. But also they changed as they learnt what was working and what was working less well. So while there was a fabulous array of different things going on, these are the sorts of themes that connected them all. And then if I could just talk a moment about the evaluation methodology itself. I suppose what we have here is a representation of all the different field work we did over the years with people. If you boil it down, in many respects, this looks a lot like a traditional process and impact qualitative evaluation. You know, there's lots of methods here that you would expect to see in different kinds of traditional evaluation of the kinds that Hardeep was describing at the beginning of the presentation. I suppose what we felt really was different about this work, and that we'll explore further through this presentation, is not that necessarily the methods themselves were distinct from what you might expect to see in other kinds of evaluation, but the kinds of questions we were asking people, the forums and the ways we were asking those questions, how we were engaging people in the analysis and bringing that together, and then subsequently what we were doing with that learning, how we were helping to feed that back in, have problem solving kinds of discussions that really changed the relationship between us as the evaluator, them as the delivery partner, and indeed Health Foundation and LGA as the funding and managing partners of the programme. So a lot of this will look perhaps sort of not so whizzy and remarkable. You know, developmental evaluation, it turns out, isn't something really mysterious. It looks like things you know how to do, but the way we applied it was somewhat different to how you might apply it in other circumstances. So what did we actually learn from SPHL then? So this is going to be a few slides now, just focusing particularly on what actually we learned from doing the evaluation. What were the lessons that we managed to gather from the partners? And I want to just start with this idea of what is the system. Sometimes when I hear this sort of question asked in an evaluation, I sigh because I think, oh gosh, we've gone all the way back to first principles. Was this really truly necessary? And I suppose actually on this instance, I actually think it really was. For many of the sites we were working with, this was their first foray into a systems change approach, into a systems way of thinking, moving away from traditional service-oriented solutions to health problems. So actually it was really interesting and important for us to find out what people actually thought their system was and how were they going to discover it and understand it. In reality, what it looks like most often was a lot of consultation with stakeholders, a lot of bringing people together. It was a sort of a real sort of shoe leather effort, getting out and meeting people and seeing people and going to where they were. And also system mapping. All of our sites made good use of system maps, both in terms of the exercise of creating a system map with a large group of people. That exercise people found really useful at bringing people together, but also then seeing what the output of that system map showed you, it revealing the complexity, revealing the relationships between partners who've never thought before, actually, I have a stake in antisocial behaviour and how that works, or I actually didn't think of myself as part of a food security network, actually showing to people that they were part of systems even if they weren't aware of it. In terms of actually describing and defining the system, you might not be surprised, considering these were local authority-led schemes, that most places or most projects chose to define their system around some pre-existing geographical or administrative boundaries. So we had several local authority boundaries. We had some where it was small or large urban areas within a local authority. So the small town of Stainforth, the slightly larger town of Blythe, for instance. And even then with the BNSSG partnership, we had one that spanned a number of local authorities, but also a footprint that is known from some of the health ICBs and things like that. So administrative boundaries were often the choice that people took. And I think it's because people knew what they were and they felt real. So I can see a question we might come on to later about what's inside and outside of your system. For this project, most places chose to use a known boundary to try and define what they were going to focus on and what was not going to be the focus. That being said, Newham did it slightly differently. They were looking at a population. They weren't so strictly bound by a local authority boundary and a place in the same sense. They could travel a little bit beyond those boundaries, thinking about things like supply chains in and out of schools, for example, for food. That possibly makes most sense to them also being part of inner London, where actually some of those local authority boundaries are less obvious than in other parts of the country. What then did it mean to take a complex system perspective? Well, this really boiled down to sort of four things for people. If you ask them what they thought complex system perspective meant, it's meant you need lots and lots of perspectives. It needs lots of stakeholders to understand it and to drive it. It means outcomes are not the consequence of a single factor, but multiple factors. When you try and make changes, it's not going to be linear. Things can surprise you. Things can ebb and flow in ways that are more complex than that. And I would say often people found it easier to describe their system in static mode. What is our system like today? What often people struggled with is that idea of, okay, so I've made an intervention here. How then do I anticipate it might change? What are the things that are happening? What's that chain reaction and that complex relationship look like? So that was where it got really tougher for people on the whole. In terms of then trying to put this into action, there were enablers and obstacles to all of this. I am going to just choose one of each. I suppose the one I want to highlight in terms of enablers was the flexibility of the SPHL programme. I think actually what Health Foundation did really, really well is to give some structure, but not lots of structure, and people really ran with that. it, I think, gave them permission to try things, not get it all right, and maybe even stop doing things and then try something else in a way that I think a lot of grant programs that I've evaluated over the years would have found really challenging to deal with, but was the perfect mentality and approach for this particular kind of way of working. I think the obstacle that I'd highlight, though, was protecting time to step back and reflect. I think these were really very, very busy people delivering this work, and finding that time to step back and I think ask the question, is this still systems change work? How has my system changed and how should I respond to that? That was really difficult. I think it's a different mindset. It's something that takes some time and you have to protect time for it. But there were moments, I think, where we all just sort of looked around a little bit and go, okay, have we lost it a little bit over here? Is this thing really responding to a system need? Or is this something that's maybe a bit different, maybe a bit more like the traditional interventions? So that was really where the obstacles came in for me. And I think it's important that I share what actually local authorities said for themselves. So this is 7 key takeaways that the local authorities came up with the support of the Design Council. The Design Council were part of the programme, sort of coaching the different local authorities in their systems change approach. Some of these, again, I think will be ones that you might anticipate. So you might anticipate, yeah, it's really important to understand your system and to invest the time in that. The investment in relationships, I think we hear that in a lot of evaluations, whether it's about systems change programs or indeed other traditional interventions in health and other matters. The one I really want to focus on is is the co-develop a clear and ambitious vision, and alongside that, we'll communicate in ways that inspire action. I think sometimes when you're a small team, and Hardeep said himself, 300k over 3 years, it's not a huge amount of money in the context of our multi-billion-pound health and social care systems. So trying to shift a system can feel like a real trudge. You're really pushing water up a hill. So actually to develop that clear vision, that sort of sunny upland that people are working towards and people can get behind is really important. But also having actors within your system who can communicate that, bring people together, keep them enthusiastic and keep connecting people and keep them working in this way, even if they're not expecting to see immediate outcomes in 1, 2, 3, maybe even 5 or 6 years. Those were really important things that the local authorities reflected on themselves and felt were really important lessons that they learned by doing this work. So what did we think then? We happily also had 7. We didn't plan that, but it's not a nice bit of symmetry that both the local authorities and we ended up with 7 key takeaways, and you can see those up here. I won't go through all of these. Some of these I've touched on already, such as the SVHL program's scope for allowing innovation and experimentation. I think the ones I really wanted to highlight were the second and third ones, which actually the more people did complex systems and the more people came to understand what it was, actually people liked it. They liked this way of working. They were enthused by this way of working. They built their skills in this way of working over time. And really, you could see it starting to take hold in some places. I think intuitively, there was a lot of people with a public health background involved. So intuitively, it spoke to a lot of their concerns that they already held about prevention. Fundamentally, they liked this way of working because it felt to them like it was supporting them to do more preventative work. It was helping them to think about things not just that ameliorate the outcomes of poor health, but to start talking and thinking more strategically about the ways you can change things upstream. So actually, once you could sell that to people, and sometimes it was quite difficult to sell that to people because complex systems change sounds complicated, actually people did really get on board with it. So I think that's something that we really took away as an important lesson. The other is it's really interesting that you could apply this in lots of different contexts. I suppose I look at our present government and its reforms to local authorities, its reforms to ICBs. There seems to be a focus on something like right sizing. What's the right size of institution to manage and change a system? Well, that certainly does have some merits to it, and there will be lots of good reasons why they're thinking in that way. But what I would say we took away from this particular program is you can do a version of systems change on somewhere quite small like Stainforth with its 6,000 people, up to somewhere like Hackney where there's hundreds of thousands of people, and it's lots of people coming and going, busy urban areas and rural areas. There are ways of making this work in lots of different contexts. And ultimately, though, that's because it's not really a checklist of things. It's about a way of problem solving and thinking about challenges. It's not, you do your system map, that's step one, you move on to step two, that's forge some relationships. It's a different way of thinking about problems as much as it is a set of techniques or actions and behaviours. So keep on over time. So let's just move on to some lessons from the actual commissioning and evaluation itself. So these are the lessons about how was it to try and evaluate this as a program. And I have to confess, it was not always straightforward. If we're being completely honest, this was not an easy evaluation to complete. I don't think that was inherently always about it being a developmental evaluation. Some of that was inherent complexity of trying to evaluate 5 different complex system programs, each of them doing it their own way, each of them doing it about their own topic and in their own very specific context. It was always, I think, going to be quite challenging to synthesize and share learning, both for the sites in a developmental sense, but also for Health Foundation and other audiences more broadly, trying to make sense of what these 5 places could teach us as a whole. So that was inherently quite challenging to do. It was particularly challenging because there wasn't a single shared theory of what complex systems change meant and how you do it at the core of the program. Now, I've said that actually the SBHL program, one of its strengths was its flexibility. That really helps the programs, I think, to try and develop their ideas and learn and try and fail and try again. From an evaluation point of view, it made it really, really difficult because we were often looking at places that were doing things that maybe looked similar, but they were doing it for different reasons, or they were trying to solve the same problem, but they were coming at it from different ways. And how could we work that out? How could we distinguish that from business as usual? That was a thing that we found like we really had to work quite hard to think about. The last one, and this is for all the evaluators on the call, I'm sure is something you recognise from many different programs around the busyness. It takes a lot of effort to change a system. If you then want to try and do some learning and some reflection and some evaluation on top of that, even more tricky. Where that left us, though, was these 3 lessons then about shared language, when it's useful and when it's not as important, trying to build reflection into the program delivery, and then flexibility on those methods. If I start with this first one around shared language, I think the challenge here is set out in that box on the left-hand side. To try and make the most of this as a multi-site program, we really needed some language that would help us to talk between ourselves. When you're doing something over here, how do I understand what that is? How can I apply learning for that in a different context? We tried to leave it open for the first year, but after the end of the first year, what we did instead was to introduce a shared theoretical framework to help sites to sort of self-assess what they were doing, help us to assess what they were doing. And what I would say, it wasn't designed to ask sites to change what they were doing necessarily. We think that would overstep the mark from developmental evaluator into sort of active participant in being part of the program delivery. That's not what we were trying to do. Although some sites did find it quite challenging just to have something new held up to them midway through. Most of them, though, actually did find the sites, most of the sites did find it quite helpful as a point of reflection so that they could look and see the framework and go, okay, well, I seem to be doing quite a lot over here, but maybe I'm doing less over here. Is that okay? Is there a reason for that? Or maybe should I adapt and change and learn from that? The framework we used in the end was a sort of 2-parter based on some of the academic literature available. The first part is on the left-hand side is the action scales model. That was chosen specifically because it's designed to be used by practitioners. It's a bit simpler than some of the other literature, sort of Donello Meadows' original work in this sort of space. But it helped us to try and answer the question with most sites, when you're doing something, which of these areas are you trying to influence and change in your system? What's the ultimate goal of this work you're doing? The other part, using a really interesting paper by McGill, trying to describe the ways in which systems change. This was a much harder conversation to have on the whole. As I mentioned earlier, people found it easier to describe their static system than the changing system. But this did give us some ideas and language that we could use with people. Actually, are there things that have, when you did them, that they were snowballed? Did you get some positive feedback loops? You know, were there moments where you made connections, where it unlocked suddenly some new possibilities that weren't there before? You know, has your system trajectory changed? But this was a useful way of trying to get people to think more and more about that, with some success, although some challenge as well. That all being said, as important as language is, it's not the be-all and end-all. And I think the really important thing we found is that quite a lot of people working on bits of these systems change approaches only saw the bit they were working on. They didn't consider themselves in the context of a system. They didn't consider themselves as part of a systems change program. So when we went to speak to them, okay, well, what are you doing and why are you doing it? Well, actually, we're doing it because I'd like to help such and such community down the road to achieve such and such. They weren't thinking systems. This is an area where we had to ditch some of the theory a little bit because the theory wasn't accessible. It wasn't chiming with how people thought about it, but try and work really hard to help people express without leading them. You know, it was really important not to lead them about how they might be changing things like people's attitudes and behaviours, how this might affect policies or behaviours, how this is forging relationships along the way. And in that sense, we had to use some very different language. So sometimes the theory was really important, like making comparisons between the programs. Sometimes we had to be incredibly flexible to try and get the best research we could. Just keep going. In terms of people's busyness and the challenge about stepping back frequently enough, I have to say sometimes thinking about systems can feel a bit esoteric compared to the thing you're doing on your day-to-day. The thing we found was most effective is you have to go to where people are and you have to try and do your reflection and evaluation work built into the work they're already doing. I think that was the way we got the best opportunities to see what people really thought and really were doing. It was also the opportunities where we could gently challenge and discuss and problem solve with them using our systems theory to assist. So for example, on the right-hand side, we altered the quarterly reporting forms that people had to submit to the LGA and to Health Foundation to say how they were using their grant, to try and encourage a bit of reflection in there. We attended the monthly monitoring meetings to try and encourage moments where people could take a step back and not just say, this is what I did in the last month, but this is why I did it and how I did it and what I was hoping the effect would be. So it was really about integrating learning into other activities and not relying too much on standalone research methods like interviews and so forth. And then the last one was about adapting those methods and being flexible. Each of those systems, as we say, represented very different places, different numbers of people involved. Was this piece of work kind of standalone, or was it plugged into a bigger strategic policy agenda? So Newham was a great example of that, where they had a big food strategy, and this was one part of that. All of these things affected who we could speak to, the types of conversations we were able to have, and how much people were thinking about what they individually were doing as part of a system. So I think what we found there is we had to adapt our methods much more than we were doing a traditional comparative evaluation. We had to really meet people where they were. And that was just another level of complexity to the evaluation on top of multiple others. I'm going to hand back now to Hardeep to wrap up with some reflections on the commissioning and on doing this kind of program as a whole.
Thanks, Josh. We've also got 7. I don't know. Maybe we must have agreed subliminally that we would all have 7. But I won't go through all of them in detail because, as you've said, some of these things have already been covered. Buy-in, for example, but I'll touch on some of them. So the program and evaluation objectives, while I don't think they're necessarily the same thing, I do think they have to be absolutely aligned. And one of the things we found as we were developing our evaluation objectives was that we needed to refine the program objectives to make sure that we were, that they were actually aligned. And that was an important learning for us. And I think that's true of a lot of evaluations, but particularly for a developmental evaluation where you're constantly having to reflect on things. I think one of the other things we also had to become comfortable with was blurring that distinction between evaluation and learning. And in fact, at one point we renamed the evaluation component from an evaluation to a learning and research component. And that was really helpful, not only in securing buy-in from all the project teams, but also, I think, more clearly communicating what we were actually trying to do, because developmental evaluation can sound a bit esoteric. As with all evaluations, really important to think about what you're getting that's new. And the framework that Josh shared with you was a really important framework for us, because it allowed us to articulate, with a lot of evaluations, for example, you tend to see things that you've seen in other evaluations. It tends to bring up the same themes over and over again. So what is it that's different this time or new this time? And the framework really allowed us to have those conversations. So yes, you might have been having lots of meetings with your stakeholders, but why were you having those meetings? What aspect of the system were you trying to change the result of these meetings? Of course, we all have meetings sometimes for the sake of them, but if there was a purpose to those meetings, what was it? And that's what we really were trying to unpick with our framework. And obviously relationships are really important, but the financial implications of doing a developmental evaluation, I don't think should be ignored. So obviously it's more time intensive and resource intensive way of evaluating a program or project, but it's also quite difficult to budget for a developmental evaluation. And we tried different approaches for the developmental evaluations that we commissioned at the Health Foundation. But I think whatever approach you use, I think it's important to have some kind of budget envelope, and then as a funder, be really flexible about how that budget envelope is applied across your 2 years or 3 years or however many years you've got for a program. Because chances are it won't be spent evenly across a 3-year period. So it's really important to allow the evaluator to lead you on that. Thank you, Josh. I think I just want to give a few takeaways before we move on to the Q&A. So I think developmental evaluations can feel risky. They felt risky for the Health Foundation. But I think they can also be quite exciting. And I think you can manage a lot of the risk by not going wholesale down a developmental evaluation route, following exactly what it says in the literature, but actually going for a more blended approach where you adopt elements of a developmental evaluation and then be really pragmatic about what you can and can't do with the resources that you have available, whether that's your staff time or money. So there are ways of managing those risks. And I should also add, in addition to the program partners we had 2 excellent advisor groups, a strategic advisor group and a technical advisor group, who really helped us think through our insights and what we were learning from the program, and also how to then feed that learning back into the program. So that was really helpful and helped us manage some of the risks associated with the delivery of the program, as well as the evaluation of it. But it's also important that we build in time to reflect on each aspect of a developmental evaluation. And so I think Josh has already mentioned we had multiple touch points, both as program partners, but also as program and project teams. We came together quite frequently to think about what we're doing, how the program is being run, and then to change course or course correct as and when we thought it was appropriate. And I think that's, for me, one of the key features of a developmental evaluation, possibly one of the most important. But I would say if you're going to do this kind of approach, whether it's systems approaches or developmental evaluations, you've got to embrace some of that chaos. Some of the best, I think, learnings we had came from very unexpected findings or unexpected happenings. Us, having to respond to COVID or the cost of living crisis, or whatever was thrown our way at program level and at project level. And in that chaos, you really find some nuggets. So I hope you've got some nuggets as well to take away from today's webinar. I'm looking forward to hearing your questions.
Great, thank you, Hardy. Thank you, Joshua. Very interesting session, and aligns lots of my experience of trying to do sort of systems-based work around the country. We've got a number of questions in the Q&A, so do please, if you've got questions, do please put your questions in the Q&A. If there's a question you particularly want answering, do upvote it. Otherwise, we'll pick questions. I'm going to abuse my position as sort of chair. Hardeep, you highlighted that question of financial implications and the cost of this, and all the way through, both of your comments. It's time consuming because it's people work and it's engaging with people, and so it does have financial implications. But do you think the value from that is justified? Can you articulate that sort of the value is better than sort of saying more traditional approaches, or have you had a strong value case come out of this?
It's a good question. I think regardless of which approach you take, you've got to generate value for money. And I think what was helpful for us was really scoping out the evaluation before we commissioned our partner, and then again once Josh and his team were in place, and the multiple partners that they were working with as well, and really think about, okay, if we're going to do interviews or if we're going to have workshops, can we do it in a way that maximizes efficiency? So can we tap into existing forums, or can we, engage with people so they're taking less time out of their day, and they don't feel like it's so much of a burden, because that's how you get the best out of people as well. So it was both about thinking how we wanted to run it ideally, and then adapting it to think about what's actually going to work in practice. Because if people aren't engaging with you with the best evaluation design in the world, you're not going to get the best evaluation findings. So we had to be pragmatic on a number of levels. But I do think if you've got a particularly complex program, where you don't have a clear idea at the beginning what your intervention might look like, because it's changing over time, I do think the developmental evaluation approach does lend itself to that really well.
Yeah, great. Okay, we'll get into the questions, and Josh and Hardeep, do jump into the questions that you want to pick up. I'm not taking them in any particular order, but perhaps because Marianne Scholl's question is about the beginning of the origins of the SPHL project. It was interesting to see that it emerged. What do you think that emerged from? That the desire to have a sort of more systems thinking informed project, and that pot of money.
Yeah, I guess I'll take this one. I think originally we'd spent a lot of time. Louise Marshall, who I work very closely with on the programme, she spent a lot of time with Harry Partner and other academics thinking about systems thinking and how it could be applied to public health challenges. And then at some point we decided to put our money where our mouth is. So we've done all this thinking. We've told people, you should be doing systems thinking, or you should be trying systems approaches. Well, actually, let's give people some funding to actually put that into practice. So that's really where it started. And we wanted to see, well, how does it work out in practice? And as Josh has told you, it's really difficult to get people to think in a different way, to apply systems thinking. And we all have different understandings of what we mean by systems as well as other things. So I think it was really interesting to see how it worked in practice. But I think fundamentally systems, approaches, and the kernel of systems thinking is quite a simple idea. Doing it in practice, very, very difficult, which is going to come as a surprise to no one. But that's really where it started. It was about us trying to actually support, all the conceptual frameworks and thinking that we've done around applying systems approaches.
Yeah. Okay, great. Marion also asked a question about the comparing it with other approaches, so the human learning systems approach and the compare and contrast, which sounds like a very big question to address in the time we've got available. But I think that I found that finding the conceptual models to sort of unpick systems at the appropriate level, as you say, that point about not being too much detail that it's overwhelming for people, but not so high level that it's not useful.
If I could just very quickly jump in and give a small shout out to the Welsh sister programme to this, the Shaping Places for Wellbeing Wales, I think they've done an awful lot of thinking about what the right model is. Human learning systems and things have been things that they've considered within their way of working. And you can see that actually different models make more sense depending on who you're working with. The ones that we ended up working with, we chose because we felt they were sort of as simple as we could make them while still being useful, because actually a lot of the work was very community-led. But actually, if you're doing this with officers and policymakers, then a different set of ideas and frameworks might be the right one for you. So I think I would just want no one to leave thinking that the way we'd come up with is the one that's cracked it by any means, but there's definitely a whole discussion of different tools you could use depending on how you want to start trying to pull on the levers in your system.
Yeah, great. I've got a couple of questions from Robert Vincent. I'll take the one that's got the most upvotes. There's a question about the particular places are influenced by social and structural influences outside that place, so limits can be what can be achieved. So how do you link emerging findings to wider policy changes that may be foundational for addressing social inequalities? And I think that, to build on it, from my experience, we do quite a lot of work where you've got national programs that are being implemented at local level. That subsidiarity and dynamic between who's doing what is quite an interesting challenge to get right. So
absolutely. And I'll get Josh to jump in as well with his reflections. From my perspective, we were quite clear that, and I think this is where the systems mapping is really important. We were quite clear that we weren't expecting sites to address issues outside of their control. So there are some things that were within their gift to change and other things that weren't. And I think that's where the systems mapping is really important, and also the theory of change work. But I mean, the sites identified multiple things at national level that they wanted to change. I think being able to then pinpoint particular issues or points in the system that they were able to affect changes around was really vital. And then also, we didn't stop them from saying, well, actually, if at national level we had this policy change, or if the government could introduce more funding to help address this, you know, we quite wanted them to engage with that. But that was a wider conversation, not necessarily what we were trying to get them to think about through the program. But I mean, absolutely, you can't have systems change at one level without thinking about the wider systems that systems are embedded in. So it's all about scale for me. And then Josh, I don't know if you want to come in as well.
Yeah, I think there's a couple of things that question really reminds us of from the evaluation. So I think one was about how we talked about the difference made. So we try to stay away from language around impact and talk instead about contribution. So a lot of our research tools really drew on the literature around contribution analysis and trying to understand not only, okay, so you're doing X, Y, Z, hoping to achieve A, B, C. You know, how are you contributing to that? But also, what else is influencing that? What are the other factors? And that felt like a more authentic reflection of what the sites have been asked to do in terms of thinking about systems. I think the question about influences outside the place and the limits to what can be achieved in one place, I suppose. I think it's easy. We often think about this, and maybe it's just the times we live in terms of things that are happening outside of our control that then stop us doing things. But there are also things that come in and that are actually putting boosters underneath us as well. And I think it's just a reality of what it means to be doing systems. And I think really what the important thing for people was that time to step back and to see how things were changing their system and then respond to it. You know, not keep doing what you're doing as though it hasn't happened and ignore it because it started somewhere else. Just because it originated outside of Blythe doesn't mean you can ignore it. And I think there were some, for example, as the cost of living crisis came up, it meant people were less able to volunteer. So actually you had to pivot your actions away from certain community actions because people just weren't willing to do it, or else do them differently so that there was a lower financial burden. But equally, then when the big pot of money came in for the Towns Fund, then you had to chase towards it and find the connection between what you were doing and that Towns Fund money, which wasn't really about what you were doing, but could be, and sort of work with that as well. So it's, I suppose it's that fleet of footness that all of the theory is trying to encourage us towards. And then as evaluators, you can see us sort of 5 yards behind, chasing along, trying to capture what was going on.
Yeah. Comes to the time, we're running out of time, so that there are quite a few questions which we're not going to be able to get to. There's one question. There's a desire to, you mentioned the desire to embed the system change in processes that would go beyond the end of the project. Will you be going back to look at those to see whether the changes are embedded when they've sustained, and if so, how? In 30 seconds, if you can, which is quite a challenge.
I think so. I would love to. I'm obviously not at the Health Foundation anymore, but yeah, I would love for them to go back and say, yeah, what did happen a year later or 2 years later or 3 years later? Were some of these changes embedded? I think that's really important when you recognise you can't achieve all the change that you want to within 3 years. So I think it is really important for us to go back and see what we actually did contribute to.
Yeah.
Great. Just a final thought on that is that was where that framework really helped us. So much work in the early phases went to structural level and relationships, but as we got further on, trying to encourage people into goals and beliefs, that's where we started to see that sustainable change.
Great. Okay, well, at 2 o'clock, I'm afraid that's where we're going to have to leave it. But Hardeep and Joshua, thank you very much. Very interesting session. Lots to pick up on, lots of questions we've not got to. But we will circulate the slides and the recording and put those on the CECAN website at this stage. Just thank you very much for attending, and I hope you found it useful. Thank you, Josh and Hardeep.
Thanks, everyone.
Thank you.